Hello, my name is Victoria Leahy. Today I'll be talking to you about brief intervention using motivational strategies. The brief intervention has 4 components. We raise the subject of how someone's drug or alcohol consumption might be impacting their health, provide them with feedback, enhance motivation to change, and negotiate behavior change and advise people about ways that they can implement their plan. What do professionals think about addressing drug and alcohol in the medical workplace? Often folks don't know how to address the subject, but once you develop a strategy, you can make it a routine part of your medical care with your patients. A brief intervention is brief counseling that raises someone's awareness that currently their behavior involves risk to their health and motivates the patient toward acknowledgement of a problem. We want to match our intervention to where the individual is in her or his change process, because that facilitates change. If we encourage people to make changes before they're ready, we often undermine the change process. These elements are important when doing a brief intervention. We want to establish rapport with the patient, express empathy, use open-ended questions because they facilitate discussion, and a particularly effective intervention is the use of reflective statements. Reflective statements both demonstrate empathy and also encourage people to discuss an issue in more detail. Motivational interviewing is an approach to behavior change that assumes that motivation is fluid, and at any given time, people vary in their ability to make a change. And because motivation is fluid, that means we can move people in the direction of change. And motivation is often influenced in the context of a relationship. The assumption underlying motivational interviewing is that resistance is normal and should be expected, and that the goal of the intervention is to address people's ambivalence about change. Individuals don't change until they perceive that change is worth their effort and that they'll gain more by changing than they will lose. The goal is to evoke and strengthen the individual's own personal motivation for change. There are 5 stages in the change process. These were identified by John Prochaska and Carlo Di Clemente. Pre-contemplation, contemplation, preparation, action, and maintenance. In pre-contemplation, an individual sees their current behavior as functional. They see no reason for change. The goal of your intervention in this stage is to increase awareness that there might be a problem and to introduce doubt. In contemplation, an individual recognizes that his or her behavior is problematic, but currently they see more value in what they're doing than risk. The goal is to enhance their awareness of the risks attached to their current behavior. In preparation, an individual recognizes a need for change but may not have an effective plan to put in place, and the goal of preparation is to help people to develop a doable plan for behavior change. In maintenance, an individual has taken action for 3 to 6 months, and the goal is to sustain the behavior change. In relapse, an individual has resumed old behavior patterns, and the goal is to get them back into the processes of change as quickly as possible. When we look at brief interventions, there are 2 models. In frames, we provide people feedback about their current behavior, acknowledge that the responsibility for change lies with him or her, provide advice about doable change, give people a menu of options that they can implement. We want to express empathy, and we want to bolster a person's sense of self-efficacy, that they're capable of making behavior change. When we look at flow, what we're providing people with is feedback regarding their current behavior and how it might be impacting their health problem. We want to listen and elicit motivational comments, and we want to provide people with options for behavior change. If we check in with our professionals, one of the things that you see this healthcare professional doing is providing a patient with feedback and options. She's providing Miss Kelly with feedback regarding the audit and telling her that her audit score indicates that she's in a risky zone for alcohol use. Remember, a score of 13 doesn't mean that she's at risk for alcoholism, but rather her alcohol consumption could be exacerbating current health problems, or she's at risk for alcohol-related health problems. And what the medical professional does is tie that score in with her current health problem. The fact that she's in the last 6 months had to go to the ER because she had an asthma attack, and what she wants her to know is the amount of alcohol consumption that she's currently engaging in could be a trigger for an asthma attack. So the goal of brief intervention is behavior change. We do that by raising an individual's awareness of problem, which in turn enhances their motivation to make a behavior change. How we increase their awareness is by linking their current behavior to their presenting medical problem and providing them with screening results. Often individuals aren't aware that the amount of alcohol that they're consuming could have health risks. Now, going back to our intervention, Miss Kelly responds with surprise because her alcohol consumption is consistent with a number of individuals her age. The medical provider acknowledges that her alcohol use isn't out of the ordinary, but reminds her that her current level of consumption presents health risks. Because she's expressed empathy and understanding regarding Miss Kelly's behavior, she's more open to feedback from the medical care provider. When individuals' behavior suggests that they're at risk for either problem drinking or for alcoholism or drug abuse or drug addiction, we want to make a referral to treatment. It needs to be meaningful and real, and also we need to check with the patient to ensure that this is a referral that they'll follow through with. Many times individuals have had previous experience with treatment programs and are willing to return. So it's really important to determine if the patient will follow through with referral. And it's best when we make a referral to a known and trusted provider. When you establish rapport and develop a relationship with a patient, the trust that you develop will transfer to a provider that you in turn trust, and the individual is more likely to follow through with a referral. Your Ring of Knowledge card handout lists a number of local resources that you can refer individuals to. As a healthcare provider, you'll be able to identify potential problems using your screening instrument, and you'll refer people to treatment only if the patient screens into a high-risk alcohol or drug use category. An effective step in making referrals is to provide the patient with written information outlining a number of referrals so that when they're back home at their leisure, they can explore them and make contact. An important thing to remember is the relapse rates with drug and alcohol abuse is similar to the relapse rates with any chronic health problem. Managing chronic illness is difficult for most patients. We see that with individuals who have asthma, individuals who have hypertension, and diabetics. And if you note, the relapse rates for drug and alcohol clients isn't any different than the relapse rates for diabetes, hypertension, and asthma. So what do professionals think about change? Initially, we think that incorporating drug and alcohol screening and intervention into our medical provision of medical service may be difficult, but so do clients think that changing their behavior is going to be difficult. And just as we can make changes, so can they as well. So, in a reflection, what do we want to achieve? What we want to achieve is that Miss Kelly makes a connection between her substance use and her unstable asthma. And because she wants to address her asthma, that will be motivation for her to make a change in her alcohol consumption, and which will result in improved health. So when we work together in our IPCP teams, we can improve patient outcomes. The next section will address practicing IPCP.